Welcome to AMGA's Executive Pulse with Dr. Brian McDonough. Each episode brings you candid conversations with the leaders innovating in healthcare delivery. Healthcare moves fast, so don't miss a beat. Let's dive in.
Hello, it's Dr. Brian McDonough, and welcome to Executive Pulse. I have a special show for you with Dr. Leon McCrea. He is an executive vice president, dean at Drexel University School of Medicine. He is a family physician. And you might wonder how I met Dr. McCrea. It was actually listening to him give a talk. And when I heard his view on leadership, I was just amazed. So first of all, Dr. McCrea, welcome to the program.
No, thank you so much for having me today. Excited to be in conversation with you.
You know, I want to go back to your talk because I just heard it a few weeks ago. And one of the things you said that really hit me and kind of made me feel ashamed was, when you wake up in the morning, do you look at your cell phone first thing? And I sheepishly raised my hand. When I saw everybody else did, I had the guts to do it, so I raised it. Let's start with that. The message that you were giving when you talk about doing that.
Well, you know, I think it's incredible, the importance for us as leaders to be able to figure out who's going to set our agenda for each individual day. And one of the things that happens, whether because your cell phone is your alarm or because it's right beside your bed or you hear that first ding, as leaders, as people who are responsible for taking care of others, we often get that first text message, that first email that actually sets our course for our day in a specific direction. And one of the things that I really want us to think through is, what would it be like if for just the first 5 minutes, before you looked at your phone, before you checked the text message, before you checked your social, if you just paused, gave yourself some reflective moments, figured out what it is that you want to accomplish, actually set your own agenda for your day before the rest of the world does it. Because as many of us know, as a leader, your job is really managing the interruptions. I can't tell you how many times I thought I had a plan for my day. And then as the emails unfold, as the crises evolve, my day has gone in a completely different direction than I anticipated. But sometimes just those first few minutes to really set the course can make all the difference day to day.
Wow, that is such a great statement. And I wanted to start with that because it's so true. So many of us, the emails just dominate our life, you know, bing, 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 bing messages. And all of a sudden, you know, the other thing I wanted to ask you about, I remember when I was in a role as a vice president, I would talk to the other ones. We always had 2 and 3 meetings at the same time. And I always felt like a lack of fulfillment because could only go to 1 out of the 3. They all seemed important and they all were important, but you had to pick. How do you deal with that? That's another issue.
You know, I think we all deal with it. What do the young folks call it? FOMO, fear of missing out. You know, the notion that like if you're not in the room and not present to make those key decisions or be part of those key conversations, you feel like the agenda you want is not going to be addressed. You know, but there's a book called Essentialism. And in that book, they really talk about the importance of narrowing your focus, recognizing you can only be present in one place. And also sometimes recognizing that we're not as big a deal as we think we are. The world will keep going without us. And sometimes the key components of whatever that meeting is can actually be sent to you in an email or as a follow-up conversation. Sometimes you need to send proxies. The thing that we can't do is we can't duplicate ourselves. And so I think we have to develop comfort with the notion that we cannot be involved in every conversation despite our want to.
When you were speaking in this discussion, we're speaking to the Delaware Academy of Family Physicians, a whole group of students and attendings, so people from all levels. Yeah. Your path to becoming a leader is very interesting. You were very honest about it. For instance, you started out, you know, I'm jealous of you in a way. You coming out of high school, you got into one of those 8 years, you're automatically in med school programs, you know, where the rest of us are like struggling along. So when you were telling me that story, I'm like, oh yeah, he's one of them. And then you took a detour. So tell me about that.
Yeah, absolutely. So, you know, I was accepted to Brown University in their program in liberal medical education. It's an 8-year program, highly sought after, knew I was going to be a physician. But then I went through undergraduate and realized I wasn't ready to transition into medical school. I wanted to challenge other notions. I came back to Philadelphia. I taught high school, in many ways disappointed my parents. It was the first and not the last time I took a detour or a pivot. But it allowed me for self-exploration. It really challenged the notion of whether or not I really wanted to be a doctor, to make sure it was my own dream. And it allowed me to actually grow. You know, the lessons I learned navigating a room of, 30 ninth grade students trying to learn biology. Some of those lessons I still use today. It also let me know that it was okay to pivot from the directed course.
And I think that's a great point for leaders, because so many of us, I know I couldn't have predicted my career, so many directions where the world changes and you change kind of in reaction in relation to it. You're an executive vice dean for educational affairs, and it's very interesting. You came right out and said, when you were young, you told someone you wanted to be a dean someday, which really is a lot of confidence, to kind of say that when you're young. But tell me about that.
Yeah, well, I think it was when I was in early in my career, and then I met my med school dean. I was so inspired by him. The dean of the University of Pittsburgh is where I ultimately went to medical school. I was inspired by his charisma, his command, but also his altruism, the direction he gave, and the confidence he instilled in us and students. And I thought that was something I wanted to be able to give to others. The scary part of it is that, once you say it out loud and you tell others, people may actually hold you accountable to get it done. And I think that, when I think about my journey and the decision to put those words to power, put those things out into the ethos, it also gave me something to reach for. I think it's totally okay to fail. But what I think is really not good is when we are in a space where we're not continuing to try. If I didn't become a dean, so what? But I'd be looking back at myself and saying, like, I didn't push myself to be the best version of myself possible.
Great lesson. And I think it's so true. And often through failures, we all know we get stronger. We kind of build a little armor. I think and I think in the medical field, a lot of people too, they do so well initially through their training, they can't handle initially those first failures. So that's an important point. A period of time, you also were a program director for residency. Yes. Tell me what that taught you. I've been involved in residency education most of my career, and it definitely is an up and down area, but it's so cool.
Well, I consider residency to be the adolescence of medical education. You figure if, medical school is kind of the formative years, that adolescence when folks just know enough to be able to go out and manage patients, but don't have the seasoning and the experience. I love those types of learners. I think that the job of residency program director is the best job in family medicine. You get to recruit, you get to mold future family physicians. You get to create an imprint on what values you hold. You also get to help people through sometimes troubling times where they have uncertainty, times where they don't feel like they're at their best. You also get an opportunity to identify talent that others wouldn't see. And so I think there's a real magic to being able to be in that space. I think about my own program director and how formative he was in my life. And I'm so thankful for the opportunity to learn from him. And I often use his lessons in how I teach residents today.
Our guest on Executive Pulse is Dr. Leon McCrea, and he is an associate professor as well at Drexel, patient care involved in his life as well. Tell me also about medical education at the university level now, where it is. Are you optimistic about our future physicians? Do you have any concerns? Where are we right now?
So I think it's a blended answer. Medical education continues to evolve. We have to have a recognition that there is so much information at the fingertips of the learner that they have to really be challenged with navigating what are the key and salient points that they need to understand. When many of us trained, we did not have access to so much information. The amount of information doubles and triples in a matter of 30 days, 60 days, 90 days, whatever that is. And that's just one of the challenges. I also think that technology has actually opened the doors for us to be able to learn so many things so quickly. We have to balance that, though, with what we believe are the essential skills that a budding physician needs to have to be successful. Patient communication, empathy, compassion, professionalism, the ability to show up every day. Those are the lessons and the skills I think that that really transcend time and space, regardless of how it is that we're delivering the educational content. I also think that we learn medicine in a much more collaborative sense. So we have an understanding of interprofessional teams. We have the understanding that no one individual is an expert and that we have to actually collaboratively care for patients. Those are all things I think that are just so rewarding about the opportunities we have with medicine today. The education just comes so far. So I'm so excited for where we are to go with medicine.
I was out in Las Vegas at the AMGA annual meeting, got to meet a lot of leaders, especially with companies and groups that are kind of working around the periphery and the foundations of medicine and AI and the use of it. Where do you see artificial intelligence going forward? Will it make us stronger as practitioners? Can it hurt us? What are the risks and benefits from your perspective?
Yeah, absolutely. So I think there are definitely risks and benefits associated with AI. Let's start with the benefits. Access to information, an ability to process things with speed. It has brought joy to my life as a provider. Ambient AI has helped me in my patient encounters. So I'm spending more time face to face with my patients and less time looking at a computer screen. Because of my medical training, I can take that information and I can help interpret it. What are the challenges? For budding learners, sometimes there is a de-skilling that happens. So we worry about the ability to do some of the critical thinking and the critical reasoning that it takes. We worry about the shortcuts that sometimes happen with artificial intelligence. And without the proper knowledge, a recognition of how do we fact check? How do we make sure the information that we're getting is completely accurate? That's the give and the take of where we are in the AI experience. But I want us to recognize that we need to embrace that artificial intelligence is here, that budding and novel technologies are a part of our existence. And it is our job to be partners in figuring this out, because otherwise we will be left behind.
What do you see as your biggest challenges as a leader, which vis-a-vis is other people's biggest challenges as well? But what do you see yourself challenged the most by right now?
Right. I would say that medical education, clinical practice, I think we are always in transition, whether it's resource allocation, expansion of health systems, hospital closures, expansion of medical school classes. We are always navigating now in the space of volatility. We just came out of the pandemic, which was transformational to all of our lives and really made us recognize just how fragile life is. And we need to really have an appreciation of just the day to day. It changed the way that we are in community with each other. As a leader, I think it is important post-pandemic that we recognize how to be in community again. We have become a community of individuals that are just as comfortable virtual as we are in person. And we need to make sure that we are actually still able to make the human connections in a virtual space that we once made in an in-person space. I often think about, my challenge as a leader is, where do I find the time to have that water cooler conversation that we used to have that allowed us to actually negotiate some of our most challenging issues? How do we really build connectivity? How do we create buy-in when the ecosystem that we operate in is just really different? And so I think as a leader, that's really the charge of us for today, is how do we make sure we keep our teams connected in a world that is increasingly disconnected?
Our guest on Executive Pulse is Dr. Leon McCrea. It's great to have you here. What didn't I ask you that you kind of wished I had brought up with getting an audience like this? Because it is a unique group of people you get to speak to in this format.
I would say the thing that I would talk about is what keeps us in medicine, what keeps us engaged, what keeps us as leaders. And I think it really is about finding the joy. I often quote a colleague that talks about finding freedom in your work versus freedom from your work. And my great hope for all leaders is that we find freedom in the spaces that we navigate day to day, because that's where we spend the most of our time. Those are the hours that actually are often our most vibrant, and that we create an ecosystem that we're not trying to escape from. So again, finding freedom in our work, navigating, understanding the infinite game, understanding how to reinvent ourselves, understanding how to really brace ourselves for a long and successful professional journey, and finding the joy in the work. The thing that I think has been most sustaining for me as a leader is that even through tough conversations, resource scarce times, managing crisis, there's an opportunity to connect. There's an opportunity to uplift. What they say, through every crisis is an opportunity. They say, don't waste a crisis, because it's a chance for us to create novel innovations to make our world better. And so I want us all to find joy in leadership.
What's next for you? Obviously, you're in this path. Do you continue that path up to deandom, or what is it?
Well, I mean, I definitely have professional aspirations to continue to lead in medical education, whatever that looks like. I often say, as we navigate these spaces, you start to understand more and more about all of the jobs. What I tell people is, the closer you get to the sun, it isn't just brighter, it's also hotter. And so you have to have a recognition of that ecosystem. But there are other things that I really love. I love philanthropy. I really, really think it is important that we understand about, judicious use of our resources to actually impact others. And so I could imagine some philanthropic and foundation work would be in my future as well, because I really, really enjoy mission-driven experiences. So continuing in medical education, working in philanthropy, those would be the things that I would see for myself in the future.
Dr. Leon McCrea, Vice Dean for Educational Affairs at Drexel University School of Medicine. I want to thank you for taking the time to join us on Executive Pulse. It's a real honor, and I think a lot of people benefit from hearing what you had to say.
Listen, thank you so much for the time. It was a blast.
Thank you for joining us for Executive Pulse. This podcast is brought to you by AMGA. For more information, please visit amga.org.